I'm Jamil Sunam. Welcome to our Tibetan Career Center's Career Awareness Program. The Career Awareness Program is an initiative through which we aim to deliver a complete information on different professions with the help of professionals who are active in their vocation. For today's Career Awareness Program, with us we have Dr. Tenzin Tamdin. We'll be discussing on the profession of medical doctor. So I especially wanted to thank Dr. Tenzin Tamdin on behalf of Tibetan Career Center team for his generous offering of help to us and taking out time from his busy schedule. So to begin with, Dr. Tenzin Tamdin, can you please introduce yourself and tell us your journey, please?
Yeah, so obviously my name is Tenzin Tamdin and I'm from Bylakuppe and I'm a medical doctor and I received my medical degree and the training from Central America Health Science University. And after graduation, I practiced there for a few months and after which I returned to India and I cleared my Medical Council of India screening exam, which is an exam that you have to clear before you get a registration in India. And yeah, and now I'm registered with the Medical Council of India and Delhi Medical Council, and currently practicing medicine as a junior resident doctor in Lady Hardinge Medical College and its hospital, which is run by central government since the pandemic. Yeah.
Thank you, Dr. So, Dr. you have been working now. So, what make you choose medicine instead of other career, and what intrigues you to walk on this path?
Yeah, so why I chose a medical line? So, to be honest, there is no like a particular one reason why I chose a medical line. And if it's like the beginning of my training, I would say it's more of like sheer interest of the human body and how it functions. And but that sort of draw me towards the medical field. But now, if it's not only interest, now I would say this professional or what kind of things this profession offers, like the stability, the responsibility, and the satisfaction that this profession offers you. Yeah, so these are some of the reasons that I chose the medical line. And also I would say the opportunities that to connect with the patient, especially during their most vulnerable times in their life. So yeah, that's also the reason why I chose the medical field.
So it is quite interesting to listen to someone like how they come into the profession. And so my next question is, what are the eligibility criteria or requirements to get into a medical college?
Yeah, so eligibility criteria in India, as per like the National Board of Examination rules and regulation, which is like the NBE rules and regulation, after +2, you should be at least, I think, 17 years of age to appear for this NEET UG exam. And before you appear for that exam, after like passing your +2 exam in physics, chemistry, and biology, right? So you should score, during my time, you should have at least 60% in physics, chemistry, and biology. So these are the main criteria to appear for NEET UG, right? So after that, you can like apply for a medical college all throughout India.
So what I've seen is in India, like to get into a medical college, you have to appear for NEET exam, right? National Eligibility and Entrance Exam. And
true.
So often people like students used to take 1 or 2 year gaps to prepare for one.
Yeah.
And even in our society, students take gap year, and even Central Tibetan administration, they offer financial assistance if an individual wanted to go for a coaching school. So my question is, what is the best way do you see to prepare for NEET exam? And is there any recommendation from your side, like some coaching center, some of the best coaching center, you know?
Yeah, so for personally for me, I didn't join any coaching center, and
Mhm.
I took a 1 year drop to prepare for those pre-med exam. But I would really recommend joining a coaching center. Also, like taking a 1 year or 2 year drop. That's also a very good option that these days we have, and especially when you get a financial help from our we get help from central government, right? Financial help.
Yes.
Yeah, so you have a really good opportunity these times, and the best way is like if you start your preparation as early as possible, like during your plus one, then it'll be much easier later, right? Because in NEET UG, it's not on the I don't think those syllabus is only a plus two syllabus. You have a syllabus also from questions also from a plus one also. So the best thing is you start your preparation from a plus one and then plus two, and maybe you will take a 1 year gap, because the competition in a NEET UG is really high. Yeah, and regarding a coaching center you asked, these days I think the Akash and Alin are the one of the top ones that we have. Yeah, and also we have like a lot of online platform these days which are very good also.
So looking at the competition, you suggest the young aspirant to take coaching classes, right?
Yeah.
How was your preparation like in early days, and how was your experience when you first entered the medical college?
Yeah, when I first entered medical college, I kind of knew like what I was going into, and
Mhm.
yeah, so it wasn't that difficult for me, I would say. So it's obviously clear that this professional demands a lot of hard work, sacrifices, and discipline and patience. So I kind of knew like before going into this field, and also it takes like 5 to 6 years until you graduate, right? So in between there was a days which I feel exhausted, and I sort of question myself whether I chose the right path or not. So but on the hindsight, it's enjoyable also sometimes, and is interesting, and it's highly rewarding, especially in the light of when you're working, uh, when you're working towards it. But I would say like before I started in this field, the struggle I think I had was I didn't have a proper guidance or a mentor
Mhm.
during my time. So that's the most difficult thing that I faced before joining into medical school. So I would recommend every aspirant to ask for help from anyone who you think might be helpful.
Mhm.
Yeah, but these days we have like a Tibet Career Center, which is very helpful for all the young aspirants.
Thank you very much. So my next question is, uh, you have seen the college life and you have been working now. So
Yeah,
what are the qualities these profession demands, like highly demanding qualities from a person?
yeah, quality. Mm, I would say for the first thing I will say is like you should be a good listener. I think you should be a good listener first, because you have to listen to what patient is trying to say, right? So for that you should obviously care for the patient, and you should be compassionate enough to listen what your patient is trying to say. And the other thing I would say is the discipline, like more than intelligent and all, I think is discipline is more important. Are you disciplined enough to wake up on time and study and read a lecture, read your notes or the books before and after the lecture? And are you disciplined enough to look into the medical records and patient history so that you don't miss anything? So yeah, discipline is very much important also, and also some amount of some uh, mm, degree of intelligence, because you have to do in academic, you have to do good in your academic also, right? So yeah, these are the qualities I would say you need to like excel in your medical school, and also after your graduation and while practicing as a doctor.
So there are some reservation seats for Tibetans in some of medical colleges in Himachal Pradesh, right? So, and the number has been increased recently in recent year from 45. So how can someone get into these colleges? And what are the other ways to get into other medical colleges?
Yeah, so the reserve seat that our society have, I think there might be some particular criteria or eligibility for that, right? So I haven't went through those criteria, but apart from those reserve seat, if you want to be like more independent after your high school, what one can do is you start your NEET UG preparation as early as possible. As I said before, like from a +1, if you start your preparation and try to get seat through NEET UG itself, so that if you are not going through reserve seat, you don't have to like you don't have that I think 3-year bond that you have to serve a community before after your graduation, right? So yeah, preparing for NEET UG is the most important thing right here. And but if you want to do your MBBS from outside India, there are a lot of Indian students Indian student going abroad to study MBBS from Russia, Ukraine, Georgia, Philippines, and many other countries. But after graduation, you have to crack an exam. There's an exam given by Medical Council of India to get registered in India. So yeah, apart from a NEET reserve seat, you have a NEET UG that you can prepare for. And also, if you don't want to do in India and want to do from abroad, you can go to foreign country to do your MBBS. And from this new rule, exam they will implement from 2023 for next exam, which is the National Exit Exam. This exam, whether you are Indian medical graduate or a foreign medical graduate, you have to give this exam to get registered in India and to practice in India.
So, Dr. Tamdin, you have done your MD, Doctor in Medicine from Central America. So was it on a scholarship you went there to study? If yes, how is it possible for other Tibetan students to get the scholarship?
Yeah, you can apply for, there's a scholarship also, you can apply for that, but you won't get like a huge percentage of scholarship. There might be like a 10 or 20% scholarship that you can get.
Dr. Tamdin, can you name some best medical colleges in India? And can you give a random fee range in both the government sector and private sector?
Yeah, the I don't think I can give like a particular cut of like a tuition fee that you have to give, because it varies from college to college and the state where the college is located, right? The top college, I would say, like in Delhi, it's like all over India, and in Delhi, it's I think the first is like a Maulana Azad Medical College, and then comes the AIMS and Vardhan Mahadev Medical College and Lady Harding Medical College also in India. But there are in India, most of the medical college academically, those colleges are really good. Yeah.
So the medicine is a broad subject, right? So
Yeah.
what are the specialization one can pursue during or after MBBS?
Yeah. After, I would say after MBBS. So after you complete your MBBS, you broadly you have a, MD and MS course, that PG course that you can pursue. But obviously, medical field, it's a never-ending field. But now, like right after MBBS, you can pursue, most of the young medical doctor, they pursue MD or MS course, which is a doctor of medicine and a master in surgery, right? So MD, it's a medicine field, and in MD you have like a MD internal medicine, MD family medicine, MD pediatric, radiology, and psychiatry. So these are like a non-surgical field that you can pursue. And also in under MS, you can pursue MS general surgery, MS ENT surgeon, ophthalmology, and orthopedic surgeon are also there. And but even after like MD and MS, there are like a super specialty that you can pursue as in India. After MD, you can do. Suppose you have done like a MD internal medicine. After that, you can do a DM in cardiology, cardio medicine, DM in neuromedicine, DM in nephromedicine, and after MS, you can do MCH, which is uh, super specialty. MCH in neurosurgery, MCH in cardiothoracic surgeon, and all. But if you want to pursue specialization or further study abroad, like USA, there's exam called USMLE that you have to clear those exams. In USMLE, there's like 3 steps: step 1, step 2, and step 3. After completing those, you can apply for residency in US also. And if it's like a UK, then you have to appear for exam MRCP or a PLAB exam that you can appear for. But obviously these exam, it needs a lot of time, hard work, dedication, consistency, and
So, Dr. Lai, you have been through like college life, and you are now a working professional. Can you tell us what are the struggle one can expect in this line, and share some of your struggles if you have any?
yeah, struggles in the medical school. As I mentioned some of it before, like this course, it takes like it's a long duration course, like it takes almost 5 to 6 years. Usually, like other regular course, it takes like a 3 and 4 years, right? So this course is 5 or 6 years. It takes like a 5 or 6 years out of your this 20 years, right? So for me personal, I pretty much knew like what I was getting into and what this professional demands. So is what it wasn't that difficult for me. And mm, I would say like before I started this journey, as I mentioned it before, like I didn't have much guidance and mentorship. But when I started in my medical journey or med school, so as this professional demands a lot of hard work and sacrifices, as I pretty much knew like what I was getting into, so I was prepared for whatever this professional demands. So, but I would say like mm, uh, when you go into medical school, you don't have much friends from your school. So suppose in my classmate we have like I think 30 or 40 students. Out of that, only two of us are doctor now. So you don't have much friends from a school going into medical school. So I would say that might be a struggle for some people, but along the way you will make a lot of friends and it'll be enjoyable, I would say.
So, Dr. La, now you are serving as a junior resident doctor. So, how is your experience working as doctor?
Yeah, experience working as a doctor. Well, I've only experienced like only a short period of duration working as a junior resident doctor, but I'm certain that this is far from just a regular office job, I would say, because in other like regular office job, we pretty much it's predictable and we pretty much know like, how the day will start and end, right? So, but in medicine, working as a doctor, it's not like that most of the days. Even your team will be surrounded by life and death situation almost every day if you are working in like a tertiary center and a multi-specialty hospital. So but at the same time it's a humbling experience also because those patients and their relatives have a trust in you and your team. And also I had an opportunity to sit with the individual when they are giving life altering news and care for numerous critical patients also. and I've been involved in some of the resuscitation also, some of which are unsuccessful also. So during this time, it's a little bit hard, but when I compare these to my peers graduating from other profession, obviously the hours commitment that professional different professional needs might be same, but when you're working as a doctor in like a big hospital, the emotional resilience and maturity that you need like at such an early age, I think it's not similar. Yeah, so working as a doctor until now, it's a decent and very humbling experience till now.
It's very lovely to listen to you. And my next question is, uh, tell us your view on what are the career scopes and opportunities are there for Tibetan doctor in our society or outside our society?
Yeah, so in our society, if we uh, in our society, we as we most of our Tibetan modern allopathy doctors, they have, I think, like a 3-year bond that we have to serve our community, right?
Yes.
So I think you during that time you have a very good opportunity to work as a primary care physician. So yeah, that's the really good opportunity that we have. But in general, if we speak like outside like our Tibetan modern medicine doctor, one can obviously always pursue MD, MS, or DNB course also, which is like the PG course, specialization course. And mm, after that, like there's, I think, the scholarship offered by there's a scholarship called Groman Gombo Scholarship, which is the MPH course at a Stony Brook also. But in that course, you don't get much of clinical contact with the patient, I think. And other than that, if you want to study abroad, like from US, obviously you have to appear for some exam like USMLE. And if you want to study from UK, you have to appear for PLAB or MRCP. So these are the some of the opportunities that you have after completing your MBBS. And like you can strictly go into like pursue into uh, research and uh, academic also if you want to teach or train a young medical doctors. You have that opportunity also. And because these days there's a lot of new medical tech company also, and also a lot of health insurance are there, right? So they also need a young doctors like young MBBS graduate doctors who can create the content and who can proofread all those health insurance. So they need a doctor. You have opportunity in that field also.
Before we conclude today's program, my final question is, what advice do you have for the students who are into the line and the others who aspire to study medicine?
Yeah, actually, I'm also at the early stage of my career now,
Mhm,
so I wouldn't say advice as in such,
mhm.
but I might have some suggestion, if I would say, that which might be helpful. So the first thing for those who aspire to become a doctor or aspire to opt into medicine, I would say don't compromise on your dreams. I know a few of my schoolmates whose dream was to become a doctor, but somehow they thought that this will be a very long journey, it will be very difficult. So they pursue into some other paramedic or nursing or some other regular course. Uh, yeah, obviously, which takes less duration and a bit easier. I know those professionals also just provide a lot of service to our community and society, but uh, nonetheless pursue whatever you really want to become and what you are passionate about so that you won't regret later. Yeah, that's the main advice that I want to give. Other advice or suggestion maybe, I want to say, like, whatever you are working on right now, if you are preparing for like a NEET UG, or if you are preparing for +2 board exam, or even if you are in the first or second year of medical school, just give your 100% on whatever you are working on right now. Then other things, like, it will align itself with time.
Thank you, Dr. La, for sharing your journey and shedding light on the profession that you are working in. So thank you very much for giving us your time and taking out time for us. Thank you.
Yeah, thank you so much, Jampila. Thank you so much.